Thank you all for being here. I see a lot of familiar faces from our first seminar, I think, but anybody who hasn't been here, so just to tell you a little bit about the Women's Heart Health Initiative, it was something that's in its infancy, right? So it's been evolving. We started it about a year ago, and the aim was to raise awareness about heart disease in women, raise awareness amongst the general public, women like you, about the risks of heart disease in women. And then as we had our first seminar and as we spoke with a bunch of you and sort of really thought about what the needs were, awareness is great. Knowing the risks is the biggest thing. But what we needed to do was actually empower all of you, right? To what can we do with these risks? What can we do to change our risk and to live a healthier lifestyle? And so that's really where the notion for this seminar kind of was born, is based on the feedback that we got from all of you. And so we really want to focus on things in our lives that we may not think have anything to do with our health. We may not think, we may just take for granted and it's just a part of our day. But let's slow down and actually look at what are the dangers associated with the lifestyles that we live. And so we're going to focus a significant portion on, stress and the link to heart disease, which a lot of data has been coming out on recently. And the second half of our program, we really want to talk about techniques that all of you can use to empower yourselves. So really, I applaud all of you for being here because you've taken the first step to learn about this and then to share what you learn with others. And so that's why I called it Changing the Mindset, our first talk. It's just to change the way we think about cardiovascular risk factors. So this concept of the whole body, it goes back thousands of years ago, right? So 4,000 years ago, Hindu healers in India would approach kind of similar techniques that what we're talking about now, that's come into trend now, but approach the whole body. And so there was this notion of the 7 main chakras. Let me make sure I know how to point. The 7 main chakras that kind of align the body and keep yourself balanced, and that if any disease came from an imbalance in one of these chakras, right? And so it really looks at Ayurvedic medicine, Eastern medicine, really focuses on the whole person. And so it looks at emotional balance, it looks at spiritual health, it looks at mental health, physical health, as all being intertwined and not in isolation. But us in the Western world, right? So cardiologists, not just cardiologists, but how we communicate heart disease and heart risk to our patients and to the public here, is that we talk about the traditional risk factors, right? So when we think about, when you all think about heart disease, you think about diabetes, you think about, you know what's going to put you at risk for heart disease, because these are the things that we screen for all the time. So high blood pressure, high cholesterol, diabetes, family history, whether or not somebody smokes. And we've gotten a little bit better. We know that when we see patients in the office, we've gotten better about asking about diet, really focusing on diet and what people are putting into their bodies, and exercise and how much is enough and what's the goal. Obesity. We know the other things that are linked, but we sort of do a very bad job at looking at the psychosocial factors that play into heart disease, because it's always been thought to be maybe something that may increase your risk, but it's this nebulous concept that's not as dangerous. But what they found, and what we'll go through, is that stress in particular is as much of a cardiovascular risk factor as high blood pressure, as high cholesterol, right? And that would be sort of unheard of. But we'll go through some of these, and again, we'll focus a lot more on stress. So let's go through some examples. So social isolation and loneliness, kind of an interesting concept, right? Social isolation, it's an objective measure. So there have been studies that use objective measures to look at, somebody's social support and their isolation. Loneliness is completely subjective. So it's, a survey, right? But when you look at these two factors, they found that there was a significant, almost a 30% increased risk of heart disease and of stroke, new heart disease and new stroke, in people who identified as being lonely or lacking social support, being socially isolated. So that's kind of shocking. And if you looked at, well, what does that mean, 30% increased risk? It's the same as being obese or being a light smoker. So think of it that way, And there have been multiple studies that also show social isolation is also prognostic, right? So somebody who's had a heart attack that leaves the hospital, that has a support system, that has family at home, that may, married, that they actually do better than people who go home to an empty house. So the takeaway message is a good one, right? Spend time with your loved ones, spend time with family and friends, because it actually is good for your health. So another example is, your outlook on life. Optimistic women, they did a study up in Boston. They looked at 70,000 nurses, and they found that actually optimistic women were less likely to die from heart disease, not just heart disease, but cancer, infections, and I think it was lung disease as well. And so it's a significantly decreased risk. If you look, the quarter of nurses that were the most optimistic actually had the 38% reduced risk of stroke and heart disease. And same thing, as I mentioned before, it's also prognostic. So after bypass surgery or after having a stent, if you have an optimistic view on life, you're less likely to be readmitted and less likely to need a repeat procedure. And then this is something that I think is much more, people are aware of this link, but again, we may identify it. I don't know that we do a very good job in treating it, but at least we know that this has been looked at before, right? But being depressed. So I can't tell you the number of times you see a patient in the hospital, and oftentimes we just don't do a good job of screening these patients right before they leave. It's all about the acute management of something, of a heart attack or some cardiac event. And then they come in for their 2-week follow-up visit, and everything's fine, but you take a little bit more time and you slow down and talk, and you can find that a cardiac event like that can actually affect people's mood quite a bit, and that a lot of them, there's a rate of 10 to 30%. I think in one study it was 15%, so right in the middle, of new depression after a cardiac event. So that's not just a heart attack, but any CAD, any coronary artery disease. And that these patients are twice as likely to die. So I must have made this slide when I was half asleep. Everybody's going to die, right? But twice as likely to die, to die early, right? So there was your premature death. And so it's kind of striking. And what they found also, because this was a study looking at women, if you look at other studies that look at this cause, depression and heart disease, the people who got depressed were more likely to be women, more likely to be younger, and more likely to be diabetics. So those were all examples of causal links, right? Something that we may not think has anything to do with heart disease risk, but actually does. But let's look at an example that's gotten a little bit of press recently, right? Of an acute, cause and effect. So there's something called broken heart syndrome. How many of you guys have heard of it? And so the classic example now has been Carrie Fisher and Debbie Reynolds, right? So broken heart syndrome is also called Takotsubo's cardiomyopathy or stress-induced cardiomyopathy. So this jar over here, all the way on the top right, that jar is the Takotsubo jar. It's a Japanese jar that they use to trap octopus. So the octopus crawls in, it turns around, and it can't get back out. And Takotsubo's cardiomyopathy is just because that's what the heart looks like. And what happens is that the heart normally pumps all together, right? So about 60% of your blood leaves the heart at any given time, so it doesn't, fully empty, but it goes like this. And that's a normal beating, healthy heart. All the muscles should come in. So something about people who get Takotsubo's cardiomyopathy or this broken heart syndrome, there's an acute event, and usually it's an emotional trigger of some kind. The classic example is, the loss of a loved one, just like in this example. And that emotional surge, that adrenaline surge, is what causes this cardiomyopathy or this weakened heart function. And actually, the entire apex, that it's sort of a ballooning out of the apex, the distal part of the heart, where that just doesn't function. And it can lead to acute heart failure, and it can predispose to sudden death just from malignant arrhythmias. So luckily this is rare. It's not as rare as you would think, but it's oftentimes mild. People can have a sudden emotional stress or it can be anything that causes an adrenaline surge. And there's some evidence that people are just prone to it. So it's much more common in women. And why is that, right? But basically anything that can cause an emotional surge can induce this. And they present with sudden chest pain. Sometimes their EKG in the hospital looks exactly like a heart attack, and then you find they're not having a heart attack. What is it? And it looks like this, you know. And so that's an example of something that happens, you know, emotionally or in the mind that has a sudden, immediate effect on your physical body, on your heart. And then just to get a little bit more scientific, so this was a study that came out. I won't go too scientific on you, I promise, but it was actually really interesting because it was the first time it came out in The Lancet, which is a very prestigious journal, in just February of this year. It was the first study that was shown in humans to show a causal link between stress and how that leads to heart disease. And so the mechanism is just detailed here. But basically what they found was that, so the proposed mechanism is that people with chronic high stress levels have activation or increased activation of the center in the brain called the amygdala. And the amygdala is, it's like an almond-shaped area in the brain, and it's related to emotions, stress, memory, you know, sort of cognitive functions. But it's involved in a lot of interesting different functions of the brain, but stress and emotions are one of them. And what they found was that under chronic stress conditions, people had more activation of the amygdala, which then led to activation of the bone marrow. Who would think that that was the next step, right? Activation of the bone marrow to release more inflammatory cytokines, inflammatory, bad stuff into the bloodstream that leads to the process called atherosclerosis, so inflammation of the blood vessel walls. And if any of you were here, those of you that were here for the first seminar, you probably remember we went through a detailed, you know, how does atherosclerosis progress and all of that, but basically it's just inflammation of the arterial walls can lead to plaque development, right, and then plaque progression. So it's a systemic, atherosclerosis is a systemic thing. It's the same thing that causes heart attack, stroke, blockage, you know, peripheral artery disease, right? But this shows that chronic stress leads to something in the brain, which ultimately leads to, you know, predisposing to heart attacks, right? And so they did a study, this was again up in Boston, and they looked at patients who were over 30 years old who were getting a PET scan, which is, they usually do for like cancers or something like that, but these people had no cancer. They had no underlying cancer. And a PET scan looks at the metabolism of different organs of the body. And so it actually labels sugar, essentially, right? And it looks at what tissues in the body are picking up more sugar. That's the tissues that are more metabolically active, right? And if you look at this picture, so the ones on, so what they found, let's get to what they found first. What they found was that 22 patients had cardiac events. Most of them were heart attacks, strokes, heart failure, that kind of thing. And those patients were all in the higher stress group. So if you look and compare, it's kind of nuancy, but let's try to imagine it, right? If you look and compare, so in the top line, they have on the left is the low amygdala, low stress, low amygdala level, right? And then you see how it's a little bit more purple on the right. There's more of that purple uptake where the arrows are pointing. So that's a high amygdalar activity associated with high stress. And those were the patients that had more of the events. And then the same thing, you can follow it down, the same thing you would see. So this is a picture looking at the aorta, and where they're pointing is if this is the heart and this is the aorta coming off of it, look at all the uptake that's in this high stress person as opposed to the aorta of a low stress person, right? So it's the same thing that they found. And what they found was that also if you look at the spine and look at bone marrow activation, so look at how that lights up like a Christmas tree, and this is pretty bland, right? And so this was the first study that actually showed this mechanism that had been looked at in animals and all of that, and sort of looked at it in humans and found evidence that was significant. So it was really remarkable. And so where does this leave us? So stress as a preventative therapy, right? And this is the same thing that we were talking about in the beginning. They've been doing this in other countries, in China and India, and focusing on this as how to prevent disease for thousands of years, and it's caught on here, and so that's why we want to focus and talk a little bit about it. But in the studies that looked at meditation and yoga as therapies, they found that it decreased activity in the amygdala, it increased relaxation and also made people more resilient to stress, that it reduced blood pressure and cholesterol, that it reduced their heart rates and their respiratory rates, and it decreased waist circumference. So all good things. And so, in conclusion, the connection between the heart and the mind is not soft medicine anymore, right? It's actually a real connection relating the mental health of somebody, the emotional health of somebody, and their physical beings. And so the key to preventing heart disease is really not just, I think, the message we need to take away from this, and the medical community and also all of you, is that the key to preventing heart disease is not just identifying risk factors and treating disease, it's really balancing your life and living a more healthy overall lifestyle. Now with that, I think this leads perfectly into our next speaker, who is Dr. Erica Jones. She is the director of the HeartHealth program at Cornell, the Dalio Center for Clinical Imaging, Cardiovascular Imaging at Cornell. And she was my program director and has been my mentor ever since I've been in medicine, and is an expert at preventative cardiology. And so I'm very glad that she joined us today.
So very quickly, yes, I run something called HeartHealth at, it's called the Dalio Institute of Cardiovascular Imaging. And so I have an interesting sort of hybrid role where I'm in cardiology and radiology, because we use cardiovascular imaging in order to find high-risk populations, usually asymptomatic, but for example, young people or middle-aged people whose father died at 50, or who have an inflammatory disorder and just want to really know about their cardiovascular health. So in that role, I have been learning more and more. It's been an incredible learning experience for me on how to deal with heart disease in the stressful population. And so what I'm dealing with are what Nisha was talking about, the modifiable risk factors, the smoking, diabetes, hypertension, physical inactivity, high cholesterol, obesity, and depression. And just to be perfectly honest, especially diabetes, hypertension, cholesterol, even obesity and depression, there's clearly a genetic link to them also. I think there's a lot of nurture nature here, but depression does run in families. Certainly type 2 diabetes does, so we have to watch that carefully. But just in your heads, think about it. How much do you think is between the non-modifiable and the modifiable risk factors? How much do these modifiable ones contribute to heart disease? You think it's 50%, 60%, 80%? It's about 90, yeah. So that's why the most I've ever seen is 90. 80, I think, is probably the one that I've seen the most. A recent study just came out again saying about 79 to 80% with the modifiable risk factors. So yes, your genes are a problem. Yes, we can't keep you from aging, but we really can work on these other things. And so then I want to think about, and just based on stress, I want to think about some of the other things that we don't always think about every day. And I don't know why radiation and chemo is in the wrong color, but oh well. So chronic inflammatory disorders, much more common in women. Lupus, rheumatoid arthritis, inflammatory bowel disease. It's a chronic inflammatory state. People who had radiation and chemotherapy, especially breast cancers, left-sided radiation, and young people who had Hodgkin's disease. The radiation causes calcification in the arteries. Women who had high-risk complicated pregnancies. People don't realize we have our babies and then we go take care of them for 20 years and completely forget about the rest of us. And so I'm trying to get people to focus. HIV, not just the medicines used for HIV, not just the fact that HIV patients are living longer, thankfully, but the virus itself is a chronic inflammatory disorder. And then what a lot of people are shocked by is migraine headaches. It is a vascular headache, and it is associated with a higher risk of heart disease. And then I sort of affectionately call these my sort of New York City disorders, sleep deprivation, social isolation. In a huge city, there's a lot of social isolation here. And so Nisha already actually spoke about this, but it's becoming more of a hard science rather than what everybody used to think was fluffy. And so, you got to be careful in cardiology. We're with a lot of hardcore people, everyone wants hard facts. They want to put stents in, they want to fix things. And so then when I come out, and Thursday, I had a colleague of mine give a talk on plant-based proteins and how it can help. And Peter Oken, he's a colleague of mine, just kept rolling his eyes. He just didn't want to hear about it, but it's really becoming a much better science. And so this is this whole talk about heart-mind connection. And so you cannot separate them. not only in the way that essentially brain health and cardiac health are intertwined. And most people, when we think about it, think more in the fact of like strokes and heart disease are both the same risk factors, and that's absolutely true. But what we want to think a little bit more about is how we can actually think differently in order to protect the heart. And so before I talk a little bit about how I talk to my patients about sort of meditative things, I just wanted to give you a little bit of hard facts. Again, like Nisha, I don't want to get too technical, but this is from the Interheart Study, which is a great international study, had over 11,000 controls and population-based controls, and so huge study in 52 countries. And these were mostly sort of surveys done, and they asked about stress at work, stress at home, financial stress, major life events, you know, and then they asked, like, do you feel like you have control? And if you don't, like, if you don't have control, then they tried to see about how that was causing or not causing depression. And really the major finding here is that literally if you had all 4 of those stress factors, you had a much higher risk of heart disease. And granted, it's not enormous, 10% versus 5%, but it's double the risk if you had not only stress at work but at home, but almost more important was this lack of control and knowing what you could do. And so people think about stress differently. You know, many could argue, I have a lot of stress. I live in the suburbs, I wake up at 5:30, I have 3 kids, I have a full-time job, I've got a dog, but I love what I do. So it's probably stressful in many ways, but I don't think of it that way as stressful. When it's stressful, it's at 3 in the morning when everything's tragic. You know, you wake up in the middle of the night and your mind starts to spin. And my best example of that is when we were trying to get my son into college, who's in college now, of course, but at 17, and he was a Yahoo, he wasn't, of course, at 3 in the morning, no school was going to take him. And so I would wake up and I would start to spin. And it was, you know, it was really almost comical. But by 6 o'clock, then he was going to get in again, you know? And so you just have to sort of think your way through these things. But it's true, you know, at 3 o'clock, no school was ever going to take him. And so when you talk about the amygdala, and then the insula is just the other part of the brain that's sort of gotten a lot of talk in this world of stimulation. And so they've done a lot of just really, really interesting studies with functional MRI. And so they can actually study people in MRI machines, believe it or not, and they can actually sort of give stresses or give a happy stimulus, and they can see the parts of the brain light up or not light up differently. And they've actually found that on the functional MRI, the amygdala or the insula will light up when someone feels pain, anticipates pain, and listens to music or craves a drug. Like, so you can make it light up differently. And so a lot of work in addiction now is going into how do we actually change these parts of the brain. And that's really where it comes to this meditation. So in the States right now, I think there's probably 2 sort of popular, I guess is the right word, forms of meditation. So Jon Kabat-Zinn, who really is the mindfulness-based cognitive therapy, and then transcendental meditation. I'm a practicer of transcendental. My nurse Maria does mindfulness, so we can talk to our patients about both. You know, you have to think of sort of your personality and what you want out of it, but the paying attention to the present and the intention and having no judgment is really it's a Buddhist-based mindfulness, whereas the transcendental is a little bit more about clearing the brain and just finding what's called no thought. Whether it's enlightenment or no thought, to me, it's all coming to the same place, and it really is, what is your personality? I grew up a good Catholic girl. You tell me to do something, I am going to do it the same every single time, and that's why I like TM. It's very easy. You've got your mantra, you go through it. And so Maria, my nurse, tends to like the being in the present more because she's constantly feeling judged, you know? And so it really kind of depends on what you want, but I think all it comes down to is you have got to find time for yourself. But some of this comes from some data that came back in about 2007, no, this was in 2012. There was a lovely article in the New York Times about the Buddhist monk Matthias Ricard, I think was his name, yeah, and he is a Buddhist monk that they called the, quote, happiest man in the world. I love this article on him. But he allowed EEG and functional MRI to the best that they could while meditating. And they found a lot of just incredibly interesting stuff. And so What happens with us in heart disease, though, is that we end up having to extrapolate a little bit because most of the studies that have been done on heart disease are actually quite small. But the hard endpoints, and Nisha already said that, is you do see lower blood pressure, you do see lower heart rates, they see improved concentration, and it all started people talking about this thing called neuroplasticity. And we used to think you couldn't really change connections in the brain, and now actually there's really proof that we can, and the functional MRI has been very helpful. And so the other reason that I actually study transcendental, it isn't just because I'm a good Catholic girl, it's because the American Heart Association actually came out and endorsed meditation a couple of years ago. And so it again comes from small studies, but here's an example. So this was a study in 213, I believe, African American men actually who were high risk for heart disease, and they had the two groups that had the same amount of time in what they were given, but the time was either spent in just what they called sort of general health education versus learning actually how to meditate. And they found after 3 months, and then they kept following them over 5 years, that they actually had a relative risk reduction of about 48% in actual heart events, so heart attacks and stroke. So this is what got people actually saying, okay, maybe there is something to this. So then after the meditation, I'm going to talk about the two other things that most people ask me about is, okay, fine, I'll meditate and I'll relax, but do I have to really exercise and how much? And so the answer to that is really what you have to do is you have to get off the couch. We want consistency and we want something to be sustainable. So 30 minutes on as many days of the week as you can, and what I call on perceived exertion scales. You actually have to be winded but not gasping. So you don't want to exercise to the point where you're gasping, but you don't want to be, walking the 14-year-old arthritic dog, because he really doesn't go fast enough for me to get. I'm going to have to carry him home soon, though, so that's going to be the problem. But the benefit does continue. Yes, probably marathon runners who have a little bit, but really not significantly better longevity than people who just regularly exercise. And quite honestly, I don't care what people do. Yes, running has probably the most data because we can study running. I don't care if you walk. I don't care if you do Pilates. I do bar classes, Pure Barre. I know the classes are here. I love them. They're hard. They're not probably as aerobic as running, but you just need to move. You need to do yoga. You need to do breathing exercises, and you need to do balance, especially as we age. So that's really what heart health is all about. And I just love this quote from the World Health Organization, that health is not merely the absence of disease, but a complete state of physical, mental, and spiritual or social well-being. And that's really what it's all about. In an appointment with me, I have a handheld echo machine. I let people see their heart. We talk about diet. We talk about imaging. This woman's having what's called a metabolic test. We look at calorimetry to see how many calories you burn in the day. And then really, for the most part, we talk about how you can actually find time for yourself. And this is just one example. We're actually running this study at Cornell right now called 4 Steps, where we have 3 groups of people who are leaving my cardiac floor who've had either a heart attack or a stent or a bypass surgery. And one group just gets general medical care. Here's your medicines, here's your follow-up appointment, off you go. The second group is actually getting a peer mentor, a little bit like an AA thing where they have someone who's already been through it to mentor them. And the third group is actually being taught how to meditate. And we're going to see if it changes prognosis. So we hope so. And I just wanted to put this slide up very quickly because this is the one I was talking to you about, where if you had a healthy body weight, you were physically active, did not smoke, had alcohol in moderation, and had a healthy diet, which was done on a point-based system. And this was actually in Swedish men, but this came out a couple of years ago. They had a 79% lower risk of a cardiovascular event. But just those 5 things, how many in the population actually had that? 2. Yeah, so there were so few people in the highest group that they actually had to combine the 2 final groups, the group 3 and group 4. And even I looked at that. I said, okay, I live this. Every day I talk about this. And I probably would have been considered group 3, not 4. more, maybe 4 now, because a couple of years ago when this came out, I've actually even changed my diet more now to being mostly vegetarian based. I just feel like the data on a vegetarian protein based diet has gotten so good. But I got teenagers in my house. There are still Pop-Tarts. There's a few little things that creep in. So I think I'm not perfect. I clearly don't smoke. I'm physically active. I have ideal body weight, and alcohol in moderation. And you have to be very, very careful. To recommend alcohol is a very slippery slope. So I never recommend it to my patients, but people who enjoy a drink, especially, well, I don't even want to say especially wine. Red wine gets its reputation from the flavonoids in the grape as well as the alcohol, but any alcohol, be it a shot of liquor, 6 to 8 ounces of wine, or 12 ounces of beer, increase the HDL, or the good cholesterol, if drunk in moderation and consistently. So by volume, the Italians and the French probably drink as much or more, but they drink much more steadily than Americans and Brits and the Germans, who drink more in binge, and that's where it's not healthy. So that's what we talk about. I think I'm going to turn it over soon to talk a little bit more about breathing techniques and yoga, but really when you see your doctor, whoever he or she is, be it your internist or your cardiologist, the exam takes about 5 minutes anymore, but what you need to talk about is how much rest are you getting? What do you do to enjoy yourself? One of my favorite sayings is stop hanging around with people that bring you down. It's really it's just, there are too many people out there that suck the energy out of a room, and you just have to make limits on those people. What do you eat? I'm not a huge supplement fan. We talk a lot about supplements, but I think if you eat a really healthy diet, you probably don't need them. We spend a lot of time at work, most of us. You better hang out with people you like at work too. And then what do you do to unwind, to enjoy yourself, and how much exercise? And that takes probably 45 minutes of my hour-long conversation with the patient. So thank you very much for your time.
Our next speaker is Tanya Boulton. She is a senior yoga instructor at Pure Yoga. She's been teaching yoga both privately and with Pure Yoga since 2000. And so before I have her step up, though, she's going to guide us through more. She's going to talk more about yoga and her experiences with that, and then guide us through a breathing exercise or a meditation exercise. So I thought that would be a nice way to end our seminar.
Hello, everyone. It's so nice to be here. Thank you so much for having me. My name's Tanya Boulton, like Nisha said, and thank you so much, Erica, Nisha, for such informative slides. I was in awe of every single one of them. Such great information, and it's so nice to see a holistic approach. I was scared I was going to come up here and sound like the fairy godmother with a few things, so thank you for that. Just to give you a little bit of a background, I've been teaching yoga for 17 years, and I started when I was 16 practicing growing up in Southern California, and it was quite the popular thing back there. It still is. And when I graduated from college, I decided to become an inner city special ed teacher where Compton and Long Beach meet. It's one of the roughest neighborhoods in the US, and I really didn't know what I was getting into. I was dealing with emotionally disturbed high school kids, special ed kids. It was a very, very rough school, and so what I did to deal with my stress is that when I'd come home, I'd go to the yoga studio and do 2 to 3 hours of meditation and yoga, and that was helping me. And I thought to myself, why couldn't I bring this into the school? And so I spoke with our principal and our administrators, and at that point the school was bleeding in so many different ways that they said, if you think that this is going to help, go for it, do whatever you want. And so I started yoga as an elective, and then I also did my master's thesis on integrating yoga in the academic classroom to help as a behavior modifier, because at this point we were dealing with weapons and gang violence, and it was very intense. I was getting my life threatened on many, many occasions, and it was a very rough experience. And so once I started bringing yoga into the classroom, things changed quite a bit. And kids were not as aggressive. They started doing their work. They were able to control their bodies and not be up and about the classroom. And I was just doing about 10 minutes every single morning with the kids. And it had a lot of profound impact on the school and the whole community as well. And then I started an after-school program and everything else. And so that was my 5 years doing that. And I'm ever so grateful for that. And then I ended up moving to Hong Kong and teaching yoga full-time for Pure Yoga that started out in Asia. And then they moved me to New York 7 years ago. So I've been teaching yoga full-time now for 17 years. And just to kind of piggyback on a few of the slides, the one thing that I've noticed recently is a lot of students come up to me and ask me, how do I deal with hooking onto a thought and spinning down a rabbit hole or rumination, like you were saying, like in the middle of the night, worrying about something, and how do I deal with not obsessing over things and like chronic phantom stress. And I find that that's a really big problem, and that's even trickling down into teenagers. I have a lot of even private client students that are juniors and seniors in high school, and a lot of people are turning to Xanax and Klonopin and sleeping aids and everything else in order to help. And so meditation is huge in terms of allowing people to calm down and create that mind-body connection and mind-heart connection. And I love, Nisha, that you had mentioned the broken heart syndrome. It's so true to pay attention to your heart energy, and the chakra is the Anahata chakra, and it's really about self-compassion and self-love, and we're moving away from that so much now, and that isolation and that loneliness and the depression and spinning in our thoughts that we're not good enough or not deserving is something that I'm noticing across the board with a lot of my students, and really reeling people back in and letting them connect to a deeper heart energy and self-love and self-compassion. And with that, then you turn towards healthier lifestyle, healthier eating, healthier relationships, doing the things that you love, and really believing in yourself a lot more. And so, with that being said, I'm gonna close this up with a meditation, okay? So go ahead and bring both feet on the floor, okay? Sit back into your chair, please, so you're not slouched over in any sort of way. So scoot all the way back. Yeah, there you go. Good. Good. And then flip your palms so they face up, so the palms are facing up towards the sky. And let your elbows relax and your shoulders soften down. Okay, and then close your eyes. And as you close your eyes, take a moment to wiggle your toes in your shoes. Good. And then let that relax and soften. And then take a moment to wiggle in your fingers. Good. And then allow for your hands to just soften and open up. And as you relax your gaze inside, start to soften the space between the eyes and bring some space between your upper teeth and bottom teeth, so the jaw is nice and relaxed and your tongue is soft in your mouth and your throat. And then begin to feel your breath moving in through nose and out through nose, just nice and smooth and slow. So it's not forced in any sort of way. And it has a very fluid, natural-like sensation to it. You can start to get more and more comfortable with the company that you keep with yourself, within your own body, physically, mentally, emotionally, and spiritually. And then begin to slow down in your thinking mind, so we're not catching on to words or phrases. We have the ability to soften in the mind and give ourselves permission to feel in our body and just connect to the sensation of your breath. And notice the space that it creates. Good, and then just take a deep inhale through the nose. And a slow, slow exhale through your nose, Good, and again, a deep inhale through the nose. And a slow, slow exhale through your nose. Okay, I want you to follow the count as you inhale for 1, 2, 3, 4, and then exhale slowly through your nose for 4, 3, 2, 1, and again, inhale 1, 2, 3, 4, exhale 4, 3, 2, 1, inhale again 1, 2, 3, 4, and relax your shoulders down as you exhale for 4, 3, 2, 1, and one more time, inhale 1, 2, 3, 4, and exhale 4, 3, 2, 1, and keeping your eyes closed. just take a moment to connect to your heart energy, your heart center. And allowing yourself to stay spacious and open, receptive. And as you leave here this evening, allowing yourself to connect to the sensation of self-love and compassion, so you are gentle with yourself. Okay, and bringing your hands together, let the palms touch. Good. Okay, thank you everyone. Namaste. Okay, all right.
If anybody has questions, we'll be around. Otherwise, feel free to reach us on email or anything like that. And perfect, and we hope to see you at future events. We'll let you know. We're thinking of the next one being sometime in the fall, and to be determined, but we'll see. We'll hope to see you all there. Take care. Have a great evening. Yeah.